Good morning. It is great pleasure that I announce the start of our consultation on the National Plan for People with Intellectual Disabilities and their families. Intellectual disability is recognized internationally as a term that describes people who have a significantly reduced ability to understand new or complex information, to learn new skills, with a significantly reduced ability to cope independently, impaired and/or social functioning, and which is apparent before adulthood is reached and has a lasting effect on development. On island, there are estimated 400 to 500 adults with intellectual disabilities and 125 children. People with intellectual disabilities experience higher incidence of challenges with health, education, behavior, financial, vocational opportunities, family supports, and other personal circumstances. In Bermuda, the majority of persons live at home, but most require a range of support services for at least one aspect of their daily lives. A significant number may require full-time residential care. The need for a plan arose from service organizations and families seeing significant gaps in our system for adults with intellectual disabilities, especially those with more complex needs. The plan development will occur in a phased approach addressing the first gaps associated with persons who are 14 years and older with intellectual disabilities for which it is identified support services become significantly reduced. We do not have a single agency or sector with overall responsibility for providing the support needed to adults with intellectual disabilities. Accordingly, the draft plan is a result of cross-ministry and sector collaboration. We are appreciative of our partnership with the Mid-Atlantic Wellness Institute, who have spearheaded this plan with the support of the Ministry of Health and the Ministry of Education. A steering committee of committed and passionate community and government stakeholders was established to draft the plan. Members included key charities, including WinReach and Tomorrow's Voices, public service providers across the three ministries, as well as advocates and family representatives. I am very thankful for their work in drafting this plan and their ongoing commitment to seeing its implementation. The plan is to be the key guiding document for the next 5 years to coordinate service provisions and development and to address critical gaps impacting the lives of persons with intellectual disabilities and their families. This plan is about building supportive environments and empowering people. The plan aims to enable people with intellectual disabilities to live long and healthy lives, be able to make choices and be in control of their lives, feel happy, safe, and supported, lead fulfilling and active lives, be respected and treated with dignity. To reach this aim, the plan sets out 5 priority areas with objectives for each. The priority areas are quality, education and workforce, policy regulation and accountability, financing, and advocacy and communication. Annually, key stakeholders will set action plans to achieve the objectives and report back to the ministry and public. Annual action plans will include, for example, steps to achieve the Throne Speech initiatives, such as the Disability Register, as well as coordinated service improvements and development across the sector. Involving persons with intellectual disabilities in the plan's development and implementation is essential. And for this purpose, an easy-read summary of the plan using photo symbols and an audio recording are available. We will be holding consultation directly with persons with intellectual disabilities and ensuring that they are represented at the Stakeholders Oversight Group. The consultation period is May 17th to the 31st. The draft plan and the easy-to-read and auto summary versions are on the government's consultation site, forum.gov.bm. A virtual town hall consultation process will be on May the 24th at 6:30 p.m. and I encourage all people to review and provide feedback on the plan in order to help ensure we strengthen the support and inclusion of intellectual disabilities on our island. Thank you.
I would like to thank the Minister for supporting the recommendations of the Steering Committee and endorsing the first national plan for people with intellectual disabilities and their families. The Steering Committee evolved from a group of stakeholders with a vision for improving the lives of this population. Administrators and clinicians have recognized the roadblocks that make it challenging for those with intellectual disabilities to experience connectedness, self-determination, and hope. Families and carers have shared their feelings of helplessness as their loved ones age out of the education system and overnight become vulnerable adults with no protection, legislation, nor roadmap to assist them to navigate available supports and services. With the vision set, the Steering Committee had 3 objectives: support an integrated response across the Ministries of Health, Social Development and Seniors, and Education. Ensure the creation of a national stakeholder oversight group under the appropriate ministry to ensure ongoing action plan development and implementation. Define, develop, and implement coordinated activities and initiatives under the 5 areas previously highlighted by the Minister. While the Steering Committee has representatives from the community organizations, the National Stakeholder Oversight Group will be led by persons with intellectual disabilities and family representatives. Inclusion is at the heart of this national plan, and the ideals of the quote, "Nothing about me without me," have been embedded in the consultation process. An easy read and audible version of the plan are available on the government public consultation website to enable as many participants to participate by removing barriers. I would like to take this time to thank the 5 organizations and their representatives who met with MWI weekly to drive this initiative. K. Margaret Carter Center, Aging and Disability Services, Tomorrow's Voices, Dame Marjorie Bean Hope Academy, WinReach, 3 Parents and Carers. I encourage all members of the public to provide feedback, as we all have a social responsibility to advocate for the rights of persons with disabilities. Thank you.
Thank you. At this time, we welcome questions from the media.
Thanks for that update, appreciate it. Sarah Lagan from the Royal Gazette. You spoke about gaps in services. Could you elaborate a little bit on what those gaps are and how they affect the everyday lives of persons with intellectual disabilities?
I can go first,
Sure.
and Marissa can add. I had mentioned in my presentation, or my statement, that what this plan addresses is those persons who are over the age of 14 and older. And so we know that persons who are under the age of 14 will have support services available to them, and then as they age or get older, some of those support services are less available. And so that is a gap, because as people age, it doesn't necessarily mean that there's a need for less services. Actually, there could be a need for more services, because different things happen to our bodies as we age. So that is definitely a gap, that there is a reduction of services available to persons as they become older.
And what sort of services are you talking about?
So therapeutic services, we're talking about access to equipment. We would know that persons with intellectual disabilities may not have necessarily have access to insurance, because they may not be working. And so services such as that to make sure that they are able to navigate around where they can find help and where they can find supports to be able to have their needs addressed.
Has funding been discussed, and is government helping to fund filling these gaps?
I think what is key, Sarah, is understanding what exists out there now, because there are many people who don't even know what government has available to them now. And so helping even to coordinate persons who are working with the intellectual disability population to be able to collaborate better to make sure that, we are navigating the system better. But funding definitely is an issue, and we would like to see more funding allocated to support services, particularly to the population of persons who are 14 and older.
Sarah, I will just add, I think a great example of another gap is the lack of the community supports. So in the past year, MWI has worked with the government to develop a community intellectual disability team. Before the inception of that team, there were no multidisciplinary supports for anyone who did not attend MWI or any other day services. And so it became very difficult for families to seek that help if they needed assistance with changes in their homes to accommodate the needs of their family members, any therapy services which were limited through the Department of Health. And similarly, a big piece, especially with those who have complex needs, are the behavioral supports that are required to be in place, not only at home, but as well at other day service sites. And so currently we do have that team that is there to support those who are not only at home, but also who may receive services from other organizations in our community. And I think being a part of this team, the intent is to ensure, as the minister mentioned, that there is a coordinated approach, that we're minimizing duplication of services, but that there is clarity from that age of 14 and up, that there's a clear transition plan, that the supports that are required are in place, and if there are gaps that are identified, that the appropriate clinicians can support to ensure that we address those gaps before they turn 18.
Because the minister is saying it sounded like it's a little disjointed, multi-ministerial, and what you're talking about there is sort of bringing people together and having everyone on the same page type thing, and being able to help families navigate easier.
Yeah, so something else that is highlighted in the plan is even the Helping Services website. We're working with government and families to ask what would they like to see, so that it is a place of resource and it will give clear direction as to who may be able to help if they cannot find the answer at that location.
Okay, thank you.
Sure, you're welcome.
Okay, that was our final question. Thank you all for attending and have a great day.
Thank you.